The following video I'm just going to put out in layman's terms. It's about using magnetic pulse to help drastically improve the results for stroke recovery. And just want to put this out right here from the beginning. There's been testing done, and I'm not going to give the link on this because there's various links, but 10 years after a stroke, the pulsed electronic magnetic field or the magnetic pulse devices have been known to help with stroke recovery, which is astounding. Normally, you have to do this right away. You should do this right away to get the best results. But after a period of time, you're not getting any more results. Well, there's a reason here I'm showing the Colosseum, because this has mainly been tested in humans in Italy. It's not an ancient treatment. It's a modern treatment. It uses pulsed electronic magnetic field, but it's been mainly tested in Italy. Typically, though, you will find it far more likely that pulsed electronic magnetic field or magnetic pulse device have been used to treat victims of stroke that are dogs or horses with great success. You won't see this used on humans much. Now, I'm just putting out a layman's video here. There is a lot of information. You can go on Google and you can look at actual medical documents that reference this, and also veterinary documents that reference this. And you'll see the main research has been done in Italy on humans, and it's not common practice to use the pulsed electronic magnetic field or magnetic pulse on dogs and horses for stroke recovery. But it's more likely. It works the same way. What happens is that the brain is deprived of blood, and it causes a stroke to happen, whereby the nerves are no longer sending a signal because that part of the brain has been damaged. What theoretically happens here, and it's not a theory, but the pulsed electronic magnetic field or the magnetic pulsar is putting an electronic or electrical stimulation deep within the body on the nerve centers. I could say in layman's terms that it's causing more pathways to be opened up as far as neurons and electricity going across the nervous system. Now, this device I would prefer using over the Soda Instruments device, simply because it's adjustable. You can set it on setting 1, and it'll pulse at every second. I believe it's 1,000 gouts per second, and it goes up to 5,000 gouts every 5 seconds. The stronger setting pulses slower. And you would want to use the north side of this, not the side that is marked S. The side that's S is south. You want to have that away from the body. Or you can use the Soda Instruments, which I think is actually a higher quality magnetic pulsar, but it's not adjustable, and it puts out about 6,000 gauss. Now, there's been a lot of, also, I just want to say this one thing, there's been a lot of information sometimes on the internet or claims that the magnetic pulsar kills microbes. Let me say that there's a patent out there for 20,000 gauss magnetic pulsar that kills microbes, but that's a patent. And also the strength of the pulsar is 20,000 gauss. Soda Instruments magnetic pulsar is 6,000 gauss. Maybe there's a slight influence on microbes, but it's not much. The Clark one is 5,000 gauss maximum strength, but it's adjustable. Either one of them is fine, in my opinion, but I would opt for the Clark one because it's adjustable. The thing is that when you're using this magnetic pulse field or this pulse will stimulate the nerves that are deep within the body where they're damaged, and send basic electricity down. You're not going to need a lot of electricity, and that's one reason I would opt for the lower priced and also adjustable Dr. Clark magnetic pulsar, because you could set it on 1 or 2,000 Gauss. You can have it like at 1,000 Gauss pulsing every second, because you don't need that much to really stimulate the nerves. But again, what's very interesting about this can drastically speed up stroke recovery. Now, the critical thing with stroke recovery is that you want to do it as early as the therapy, as early as possible. The magnetic pulse is not the standard therapy. But if you do the other standard therapy, which is like massaging of the area and movement of the limbs manually by somebody who can help just keep things moving, that will drastically reduce the time that the stroke recovery takes, and you'll get virtually everything back in almost all cases. Now, in the case of using the magnetic pulsar, the stroke recovery should be more complete and done a lot quicker. That's because you're actually sending electrical currents directly into the damaged neuron area. Now, I would also make sure to take plenty of vitamins, especially the B vitamins, the B6, the B3, which is nicotinic acid. A lot of times these B vitamins are very important for nervous system health. I don't think they're going to make that much of a difference as far as stroke recovery, but every little bit helps. But I just want to point out, and you can look this up on the internet, that they've been using pulse electron, they call it PEMF, or it's pulse electronic magnetic field. I just call it magnetic pulse devices, for drastically speeding up the stroke recovery process, and also if you bring it about a more complete recovery. But what's unique, and the thing is, I don't 100% have all the statistics in front of me, like in other words the studies. I've seen this written several times, that this will also have the pulse. This is where it's unique. The magnetic field, or the magnetic pulsar, will help people with strokes that have not completely recovered, even 10 years after the stroke. To me, that's astounding news. And I did not get that information off of any kind of blog. It was a medical document. I did not get that from any kind of area that was selling the devices or anything. But, just even though it's claimed by the people that are doing the therapy, it doesn't necessarily mean it's correct. But I found that bit of information to be stupendous, because after so many months, you're only going to get so much back. If you do this, if you do the therapy right away, and you do it the right way, and you keep doing it thoroughly, normally you're going to get back almost all the motor functions, and you're going to be almost 100% complete, like almost as if you never even had a stroke. Pretty close to 100%. With the magnetic pulsar, the stroke recovery should be faster, even more complete. But in the case of, if you got 50 or 70% back where you were, and here it is 10 years after your stroke, physical therapy, I don't know, doubt it's, typically it doesn't do anything else. It's like, that's whatever you got. There are people out there that have been using this method with the magnetic pulsing that have said 10 years after the stroke, and people have not gotten everything back, have seen more results towards getting full motor function 10 years after the stroke using this magnetic pulsar. I have not seen the actual case studies. I mean, I saw this in print by people who have done the therapy that are not selling the devices or anything. But, it makes sense because, and I would also it's something that, if you were doing this, I wouldn't expect the results inside of a day. If you had a stroke 10 years earlier and you still had some problems with your left arm or whatever, your right arm, whatever, I would not expect the results to right away. I personally would do this if that was me. If I needed to do it, I would do this. That's why I'm just putting this out there. It's not, making some lofty, crazy promises or anything like that. And I'm not trying to sell a device. There's no link to buy these devices. I already own the Dr. Clark magnetic pulsar, the one that's adjustable. Either one of them is good. Actually, I think the Soda Instruments will outlast the Dr. Clark, but the Dr. Clark is built sturdy enough that you're never gonna wear neither one of them out. The Soda Instruments one is a little stronger than the Dr. Clark, but I personally opted for the Dr. Clark device because it's adjustable. You can set the pulsar at 1,000 Gauss to pulse every 1 second, rather than having a stronger 5,000 Gauss pulse every 5 seconds. In the case of the Soda Instruments, I think it's a 6,000 Gauss pulse every 5 seconds. But the strokes are the most common debilitating disease affecting Americans in the United States. Strokes are, and the other thing is too, a lot of times these hospitals are so busy, and they're supposed to do the therapy, or they don't do it, or they do too little of it because they're too busy, and they usually give it to people that are not getting that much money and are overworked. So if you're a family member, if somebody has a stroke, you want to make sure you get in there and do the help. You ask them how to do the therapy, and you do the therapy yourself. But maybe they're not going to let you put a magnetic pulsar in a hospital. But then the fact that this device can actually work many years even after the stroke, even further improve function. Because I would look at it like this: if you had a stroke, and even if you thought you got everything back, I would use the magnetic pulsar for like another year to make sure everything's back. And sometimes vitamins do help. Sometimes, even like with vitamin E, which is a natural blood thinner. Sometimes it can help with problems with clots. And a lot of times vitamins and vitamin C can help with even your cardiovascular health. A lot of times that can even prevent strokes in an indirect way, by just making the body healthier and stronger and repairing where it needs to be. I'm of the personal opinion we could probably live many decades beyond what is commonly believed is the end age of people. Even if they commonly right now, they think 120 would be an extremely long lifespan. I personally think we can go way past that. I may be wrong, but I've always been looking into these things. It seems that there are certain bottlenecks we run into, just not related to this video, but one of them is the telomeres on the end caps of our chromosomes. If we can keep those telomeres long, we literally live for centuries and stay like we were 20-something years old. To give an example, in a lobster, it could be 500 years old, and they don't age. They'll be exactly like as they were when they're 1 year old. What they die from is predators. So, and a lot of these electronic devices do work, provided you use them properly. The only thing I've really seen where the magnetic pulsar has been used more commonly is with pain management, and that makes sense because it's a pulse, electrical pulse that gets down into the nerve endings, and it helps with pain management. Maybe you have pain in your ankle from an injury or whatever, or some kind of arthritic pain. It can help with that, and that's because it's actually getting at the area where the nerve endings are. And that does make sense from the stroke recovery angle, but this is not a theory I'm just bringing out here. It's been proven with dogs and horses and people that the magnetic pulsar will greatly aid in stroke recovery. Yet, you're not seeing this offered in hospitals like in general, but you will. And even in Italy, you're not seeing it in all the hospitals either. But it's just that that's where some teams of doctors have been using it on humans. So The principle is solid. And again, one of the most interesting points about it is that typically you got so many months and you do the therapy, especially if you do it early, you're going to get pretty close to 100% everything back if you do the therapy thoroughly and often as needed, and you get on it right away, right after the stroke happens. Well, after so many months, you only get so much back doing the physical therapy. With this pulsed electronic magnetic field, or magnetic pulsar, there has been written claims from the people that have used it that it helps even get more motor function back with people that have had a stroke 10 years prior. I don't know of any therapy out there that does that. That's, to me, stupendous. I don't know if it would still bring you back 100%, but considering the devices are only like $350, $400, that is pretty cheap considering that it's a one-time purchase, and you can just use it and use it and use it. So, and again, the public is not aware of this. So this is just the purpose of this video, is just to put out it in simple, common sense, layman's terms, and you just look up PEMF stroke recovery, and then also PEMF stroke recovery dogs, PEMF stroke recovery horses, and you'll find the various studies out there, and it's not something that is made up. It's not a made up theory. It's actually worked. It's something else. I am just astounded why they don't do these things in the hospitals like the way they should be, because it's like, well, I'll give an example. They knew back, they didn't know about vitamin C, but they knew back, I think it was sometime in the, 1700s or whatever, that if the sailors aboard ship ate lemons, limes, and oranges, that would not succumb to the effects of scurvy. And it took the English Navy, I think, 150 years before, even after they lost all these crews and the medical knowledge was out there that limes and lemons and oranges would prevent scurvy. It took them 150 years before they actually issued this to the English sailors, and they actually lost, untold numbers of crew members. Like most of the crew would die from scurvy on some of these trips due to not having the correct nutrition. I mean, the medical community doesn't move fast. It's a very, I don't know, fuddy-dud thing. I just can't believe why the medical community doesn't move fast to jump on these things, because I don't know, does it affect their money somehow on, I don't know, maybe not. I don't even see how this would hurt their revenue stream to do this procedure. So anyway, in common sense layman terms, it seems that I know that the tests show it works. In common sense layman's terms, you would think it would work, because what is actually happening through these nerve endings? It's an electrical pulse. Well, by forcing an external electrical pulse, whatever's damaged, it's like you're forcing growth, I guess, or something. There's new pathways to happen, whereby your body can take over and use those pathways to control motor functions where the area was damaged before. It's forcing new, that's what they say how it works. It forces new pathways. The electronic magnetic pulse forces new pathways in the nervous system, and that's how the recovery works faster and better. And seems to they'll tell you it works even after 10 years after. Now, like I said, 10 years after, I don't know, if a person's got 50%, if they use this, are they going to get 100%? I don't know. Maybe it'll get so much better, and then that's it. I don't know. But you never know. You never know. Consistency and not giving up hope is sometimes a lot to do with it, too. So, people that stick with a program, don't get discouraged, often get better results. And this is on the right track. This is not something that is snake oil. It is on the right track. And it's been proven. It's been proven. How much of a difference does it make over physical therapy and versus physical therapy plus the magnetic pulsar, it's a significant difference. But you know, I'm not getting. I've seen where they shown dogs that were not getting better from a stroke, and they're dragging their hind legs, and they use this magnetic pulsar, and the dog came back 100%. The dog was able to use its hind legs. So I have my kitty cats. They're pretty damn young right now. I got a bunch of little kitty cats, and if any of them gets hurt like this, and I don't know, something happens in their old age, I got my magnetic pulsar. I'm going to take care of my kitty cat and give him another 10 years or something. So, and again, you know, it's the where they've really done the most for humans and done the work on humans with this technology has been in the country of Italy. Okay, over and out.